Greetings to all, and thank you for listening to our presentation, which is titled Decreasing Anxiety in Mental Health Patients Through Aromatherapy. My name is Sue Morin, and I'm a psychiatric nurse practitioner and the director of an outpatient partial hospitalization program at Mather Hospital Northwell Health, located in Port Jefferson in Suffolk County, Long Island, New York. I've been in the psychiatric field 28 of my 33 years in nursing.
I am Gloria Fortune. I am a psychiatric nurse practitioner at the Partial Hospital Program, Mather Hospital, Northwell Health. I have been a psychiatric nurse practitioner for 21 years. I have been in the psychiatric field for 31 of my 35 years in nursing. Disclosure. The presenters disclose no conflict of interest with this presentation.
For this project, we were able to reduce our patients' reported anxiety by 73% when participating in aromatherapy using lavender oil. Aromatherapy is an effective, evidence-based, holistic modality to integrate with the patient's other current treatment.
We would like to share our success so you can utilize these integrative practices with essential oils to decrease anxiety with your patient population. So, how to begin?
At our Mather Hospital Partial Program, we serve adult, adolescent, and eating disorder clients from adolescence through older adulthood. The purpose of our performance improvement project explored the effectiveness of aromatherapy on the following outcomes. 1, decreasing anxiety among patients, and 2, increasing patients' knowledge of complementary treatments and understanding how aromatherapy augments, not replaces, current therapy. The significance of our project is related to the concerns of the dangerous outcomes when anxiety goes untreated. Anxiety is a normal response to stress, so we can't live without it, and it often motivates us. However, in excess, it can be detrimental. Negative outcomes may include depression, substance abuse, chronic medical conditions, and in extreme cases, suicide. In the USA, 40 million adults and very sadly 1 in 5 adolescents are affected by anxiety disorders. Medications alone are not always effective, and coping skills, although work maybe on one day, may not work the same way the next. Nurses in all areas are in a key position to help patients with anxiety use aromatherapy to augment their treatment and improve outcomes. Most of our patients at Partial Hospital struggle with anxiety. Prescribers in our area use medications like benzodiazepines minimally, if at all, due to our severe addiction crisis on Long Island. Helping our clients decrease their anxiety through the addition of holistic modalities in conjunction with their prescribed medication may potentially decrease the need for medications like benzos. The literature review indicates that the anxiolytic activity of aromatherapy using lavender has been demonstrated in several small and medium-sized clinical trials. The efficacy is thought to be a mind-body experience due to the psychological effect of the fragrance combined with the physiological effect of the oils in the limbic system. Several studies used measures such as the Hamilton Rating Scale for depression and anxiety, but for our purposes, a simple Likert scale was used to provide a brief and immediate subjective anxiety report to determine immediate response to the essential oil. Aromatherapy is a holistic method of treatment. It uses essential oils from plants for healing through direct inhalation, and the use dates back thousands of years in areas like Egypt, India, and China, to name a few. Our great nursing leader, Florence Nightingale, used lavender oil to anoint the dying soldiers during the Crimean War and provide comfort. Currently, essential oils are used worldwide in the management of pain, depression, anxiety, some cognitive disorders like Alzheimer's, insomnia, nausea, and stress-related disorders. It's an adjunct, hence an integrative approach, to enhance the effects of medication and other therapy. Commonly believed to be relaxing for the mind, as it helps in relieving anxiety. Lavender oil, and we use Lavandula augustifolia, can have strong effects on both cognitive performance, mood, and relaxation. So how do essential oils work? They have a physiological pathway that results in immediate effectiveness. When oil enters the body through inhalation, they immediately reach the olfactory epithelium, which is located on the roof of our nasal cavity. It then stimulates receptors, which carry signals to the olfactory bulb and the olfactory cortex, which causes you to recognize the particular scent of the oil. The cells also carry signals to other areas in the limbic system, which is responsible for memory, instinct, and mood. So the olfactory system is the only sensory mechanism that involves the limbic system and the amygdala. So this is involved in emotional learning and memory and explains the connection between smell and memory. Inhaled odors activate the release of neurotransmitters such as serotonin, endorphins, and norepinephrine. Thus, it alters mood, reduces anxiety, and interrupts the stress response. So meeting our objective, we were very fortunate at Mather Hospital to be supported by a visionary CNO. Through her vision, planning, and advocacy, we had the opportunity to become schooled in the art and science of aromatherapy from an internationally acclaimed aromatherapy organization. We completed the R.J. Buckle course, Clinical Aromatherapy for Health Professionals. Gloria and I educated and coached RNs and NPs at the Partial Hospital in the safe use of lavender oil. And after completing a competency test, they then instructed patients in aromatherapy during medication education groups. Transformational leadership allows for the recognition of areas in which change is needed and guides change by inspiring followers and creating a sense of commitment. In addition to continued support from our CNO, we are supported by our AVP in Behavioral Health, and we collaborated with other leadership and committees for policy development and IT for documentation. So how we went about implementing and collecting data. Our subjects are patients attending the outpatient mental health program, and they volunteered to participate in this aromatherapy project. Our target goal was that 50% of our patients would demonstrate a decrease in anxiety as evidenced by before and after anxiety measurement. Prior to starting the project, we took several steps prior to our data collection by developing a patient safety handout. Nursing informatics assisted us with developing a note in the EMR. Pre and post data was collected from information recorded by the nurses before and after, and that rated the anxiety from a level of none to severe. And then a quarterly report from the EMR is run to evaluate the pre and post scores in response to anxiety levels to see our effectiveness in decreasing anxiety with the use of aromatherapy. This next slide is an example of some of the education provided. It was a handout developed. Very important that patients understand the high level of flammability of oils, that it can cause skin irritation, how to handle if the essential oil should get in the eye, for example, and also that they are toxic to pets. Of concern, cats do not have the enzyme to break down the oils, so we don't want oils going home to animals. On this slide, we see the aromatherapy note that was created for our behavioral health department. Data is transcribed from the patient's pen and paper rating scale to the electronic medical record by the nurse. She's going to indicate what program the patient was in attendance for, whether it was adult, adolescent, or eating disorder, the indication that the oil is being used for. So for this purpose, it would be anxiety. They record the level of anxiety, whether it was none, mild, moderate, moderately severe, or severe. And then we screen the patient before they enter the group for any contraindications or allergies. We obtain verbal consent for the children. We also have a written consent form that we obtain on admission from the parents. We review the risk benefits. We indicate the oils selected, and then we do a reassessment following the group and record that data. What's wonderful is reports are then pulled by our informatics department from the electronic medical record, which assists us in tabulating our results. And on this next slide, we see the results that we had with our aromatherapy group for the year 2017. We had a bit of a slow start. Our adult program started out well, as Gloria had actually taken the R.J. Buckle course, so we saw that we needed to do some re-education. So we provided some additional guidance and structure for the implementation of the group, and as you can see, the results greatly improved. And overall for the year 2017, our improvement was 73%. Again, reminding you our goal was 50%, so we did far exceed our goal.
We wanted to provide a brief experience of the use of lavender essential oil via aroma sticks and mindful breathing techniques to decrease anxiety. This is an abbreviated adaptation of the aromatherapy group that is practiced at the Mather Partial Hospital Program. We start the group by providing the clients with information about lavender aromatherapy, the use of essential oils, the safe handling of essential oils, and we obtain consent. Next, we inform the clients about how the aroma sticks are made at the program. Inside the aroma stick, there is a cotton wick. A carrier oil is needed to extend the aroma of the essential oil. The carrier oil that we use is a jojoba oil. We place 4 drops of jojoba oil on the wick, and then we place 15 drops of the essential oil on the wick. The wick is placed inside the aroma stick. We give each client a labeled aroma stick. We instruct them to remove the cap and gently, underneath their nose, inhale the lavender. When we first started using essential oil at the Partial, we simply placed 4 or 5 drops of lavender on a 2x2 gauze and placed it in a medicine cup. The clients found it to be quite effective. However, we switched to the aroma sticks because they lasted for at least 30 days. The clients could take them home and use them as an additional tool when they were experiencing panic, anxiety, or insomnia. The clients have reported good relief from the anxiety with lavender. They are also happy and very interested in using holistic methods of managing their symptoms. They report that this helps them to feel healthier. Now, with the next slide, we will start the breath work. Start by becoming comfortable in your chair. Relax into a soothing and upright position. Hands resting comfortably. Gently close your eyes or keep them barely open with a warm gaze. Observe and relax your body. Be mindful of the feeling of your body in the chair. Be conscious of your connectedness to the chair and the floor. Start by taking several long, slow, deep breaths, breathing in through your nose and out through your mouth. Let your breath find its own essential flow. Watch your breath as it moves into and through your nose, as it passes down and inflates your lungs, expanding your chest and abdomen. Pay attention to your breath as you exhale, watching your chest and abdomen deflate. Be aware of the breath passing easily through your nose and mouth. As you inhale, inhale the lavender through the aroma stick to enhance the healing relaxation of the breath. Follow the healing breath in and follow the healing breath out. Follow the lavender in, follow the lavender out. Follow the calming breath in and follow the calming breath out. Follow the lavender in and follow the lavender out. Follow the peaceful breath in and follow the peaceful breath out. Experience the rhythm of your breathing and allow it to guide you to peace and tranquility. Know always that your breath is with you. When your mind starts to wander, as it always will, come back to the breath and the lavender. As we end our mindful lavender breathing, slowly open your eyes and with awareness return to the room you are in. Remember again, the breath is always with you as a source of calm and relaxation. The breath connecting you to yourself and the universe. Create the intention of practicing mindful breathing with lavender. And so, in conclusion, as nurses reported becoming more confident in utilizing essential oils in combination with teaching simple breathing exercises, our outcome scores continue to improve. Patients are currently reporting positive use of aromatherapy at home as well as in the program. They say they keep them in their pocketbooks, their pockets, and if they're having any kind of anxiety or panic, they'll use them and they get quick relief. Feedback on the Press Ganey and other internal monitors have been very positive, and finding ways to prevent and treat anxiety is an urgent need to prevent additional complications and safety issues for the patient. You can contact us at Mather Partial Hospital at 631-473-3877. You could reach Sue Morin at extension 7956 or myself, Gloria Fortune, at extension 4459. We welcome any questions that you may have. Thank you very much for listening to our presentation.